Welcome back. According to the American Cancer Society, nearly 1 in 8 women will be diagnosed with breast cancer in their lifetime. Screenings, particularly mammograms, are crucial for early detection, which significantly improves survival rates.
The recent passing of popular TV host and former MTV personality Ananda Lewis after a 6-year battle both shocked and saddened fans, underscoring the importance of women knowing the facts about prevention and care. Here with us now to discuss common breast cancer myths is board-certified OBGYN Dr. Stephanie Hack. Welcome, Dr. Hack. Thanks for joining us.
Thank you for having me.
Now, I want to start with something that I find is most confusing, breast cancer screening. Over the years, the age of when you should start getting your annual screening has changed. Can you clear up any myths about when you should start?
Sure. So the different recommendations depend on who you ask. As you mentioned, the American Cancer Society has one recommendation. The United States Preventive Task Force Services has one recommendation. The American College of Obstetricians and Gynecologists have another recommendation. Generally speaking, we recommend shared decision making, meaning we have a conversation with you as a woman about what your concerns are, what your risk is, and when to start screening. And the American College of Obstetricians and Gynecologists, ACOG, we recommend starting at 40 years old for women of average risk, and that's the important thing to mention.
And why do you think so many women, especially Black women, might delay getting mammograms, especially when they do know those risks?
Sure. I think it is multifactorial. First, we manage a lot. Right? There's a lot going on in the world in general, and then there's a lot going on in our own individual world. So we are constantly doing everything for everybody, and one of the parts of that is that we're constantly deprioritizing things that need to get done for ourselves. So, oh, you know, a mammogram, I can get it next month, or I can reschedule. So I think that's one piece of it. And then there's also an element of not really understanding when to begin screening, as we've kind of talked about already. And then also there is some fear. There's something kind of denying, like if I don't pay attention to it, if I don't do it, then there's not going to be a problem. I think all of those play a role.
And can you talk about the different types of mammograms? Now there's 3D mammograms, and they're even incorporating AI into these screenings. What should a woman choose if she's never gone in for a screening like this before?
Sure. Most places will offer 3D mammogram, and that's the one that I would recommend. I know when I had my last mammogram, I said, sure, I'll try the AI, like, if that has better detection. But generally going with the 3D mammogram, if that's what you have access to, is the best recommendation. And again, mammogram is the gold standard for screening for breast cancer.
And what should women know about, breast density and family history? If, you've had a parent that has had breast cancer, what should they know about those different screening plans?
Yes, that is very important because that is going to affect your risk. As we talked about with beginning the screening at 40, that's for women who are at average risk. Average risk is that 1 in 8. That you mentioned, 1 in 8 women is going to get breast cancer in her lifetime. Well, that's a 12% risk. So if your risk of getting breast cancer in your lifetime is 12 to 13%, you're at an average risk, and you would start at 40. But if you have a family history of breast cancer, or if you've been diagnosed with breast cancer before, then you would have a higher risk, and then you would need to start screening earlier. So knowing your genetics and your family history all plays a role in helping to determine your risk and when to begin screening.
Let's talk about Ananda Lewis for a minute. She's so young. She passed away early 50s, and I read a quote about her saying if she had known 10 years ago the importance of taking her vitamins, cleanses, getting good sleep, exercising, that could have helped prevent the advancement of her cancer. This is what she said in one of her quotes. What would you say to women watching about just total body care and how it can affect the onset of any cancer, not to mention breast cancer?
Sure. I would say eating a healthy diet, limiting sugars, drinking a lot of water, regular exercise, all of those things are going to improve your health overall. But then, unfortunately, for some of us, even if we do those things, we are still at risk for developing certain conditions like cancer. So I'd say always healthy diet and exercise are always recommended. tested, but also constantly being in communication with your healthcare provider to know what screenings you're due for. So if for some reason you're at risk, that you are getting the appropriate screening and able to detect things in time.
Dr. Hack, thanks so much for joining us. We appreciate you for coming back in.
Well, for more information and resources on breast cancer screenings, visit Dr. Hack online at ladypartsdoctor.com.